responders to consider carrying narcan, a drug that can reverse an overdose. Our Mark Salinger explains how that drug is able to bring people back from the brink of death.
It's so small it can fit in your pocket, but naloxone, or narcan as a lot of people know it, can be a miracle drug for someone who is overdosed. It comes in a couple forms. It can be a nasal spray, or it can be injected into the body. Doctors call it an opioid antagonist. All that means is it attaches itself to opioid receptors and blocks the effects of the drug someone has overdosed on. We hear about overdoses all the time these days. They happen when someone ingests so much of a drug they become unresponsive. The drug overruns the opioid receptors in our bodies, slowing the speed of breathing and other vital functions. Soon, lips and hands start to turn blue. Within just a couple of minutes without oxygen, brain damage can start to happen. That's why time is so important. When naloxone attaches itself to the opioid receptors, it counters the effect of the drugs. Soon, it begins to reverse the impact of the overdose, but it must be administered quickly after someone overdoses. If it's given fast enough, the person can start breathing again within just a couple of minutes. They're coming back to life as the impact of the drug is blocked. Sometimes they can come back in a daze, often mad, scared, and aggressive as they're coming down from their high. But let's say someone is given naloxone by mistake. They haven't actually overdosed. The medicine has no effect on the body. It's a tool that fits in your pocket, powerful enough to save a life.
Hey guys! Today's video is all about naloxone. We're going to talk about how Narcan, this life-saving medication that's inside here, is easily accessible to you. But more importantly, we're going to show you what's inside this kit, how to use it, and how it actually works in the body, so you have an understanding as to what's going on when we use Narcan. Welcome back. My name is Tammy and this is Nurse Minder, and on this channel we do everything nursing. So if you're new here, consider subscribing below so that you get the next video. Okay, so naloxone, the generic name, so it's always with a little n, or Narcan, the brand name, has the capital N. This is an opioid antagonist, which means it will reverse the effects of opioids in the body. And so in order to understand what the antagonist does, let's take a step back and see what an opioid is and does. Now, opioids are often prescribed for pain, but we also know that they are available on the street. And so you may recognize names such as fentanyl, that's a huge one on the street. Morphine, oxycodone, hydromorphone, those are all medications we want to make sure that people are not overdosing on, because not only does it get rid of the pain, but it decreases their drive to breathe. So how does an opioid work? Every cell has particular receptors, and let's just say this is my opioid. And as it's floating along here in the blood, it recognizes that it fits in this receptor, snugs right in there, and this will change the function of the cell. Now we have opioid receptors throughout the body. They're in the brain, in the brainstem, in the spinal cord, and even in our intestines. I mean, one of the most common side effects that people who take opioids complain about is constipation. And so when the opioids bind to those receptor sites in the intestine, they slow down motility. But it's the receptor sites in the brainstem that are actually causing us the troubles with decreased drive to breathe. Every cell has unique receptors that will alter the function of that cell. And when the opioid floating through the bloodstream happens to land and fit into that receptor, it changes the function, which in this case, if it's in the spinal cord in your peripheral nervous system, it will bind and it decreases the pain signaling up to the brain. That's awesome. But we also happen to have receptors in the brainstem, which is going to decrease breathing. And so what happens is when the receptor site comes here in the brainstem, it sends a signal to the body to slow down breathing. Now, depending on how much opioid the patient has on board and how naive they are to medications, we may or may not see this happen right away. So the question is, how does Narcan work, and why would we give this to reverse an opioid? I'm going to show you. We're going to say that this colorful one is my Narcan. Consider Narcan to be like the bully in the playground, although this is a really good bully. He comes along, and Narcan has a really strong affinity for the same receptor site as our opioid receptor. And what that means is when it sees that receptor site, it wants it and it's going to fight harder for it. So when Narcan comes into the bloodstream and it happens to come across opioid, it's going to bump it out and it will sit in there. It takes its seat inside the receptor site, and then that signal to change the cell's function has stopped and it will continue to go back to its normal functioning. So what does this mean for our patients? Our patients will wake up with a bang, and if they had a lot of pain, it will all come back. Let me tell you a story. Now, the first time I experienced the actual use of Narcan, I was working as an emergency room nurse in downtown Winnipeg, and we diagnosed this patient who had just come in as an opioid overdose. We're going to give Narcan to really rule in our diagnosis. At that time, only one dose of Narcan was needed to rule in or rule out. Things have definitely changed since I started nursing, and now you might give multiple doses of Narcan before you get the response I'm going to share with you. But as they're preparing the Narcan, and I actually don't recall, I don't think I gave it. I think I was just like witnessing the whole event. They gave the Narcan, and the other nurses, I think there was 3 of them in this bay with me because this is a patient who's unresponsive and their respiratory drive is down, so there's a lot of us working with her. They happened to just step outside the bay, and it wasn't far. I mean, this is an emergency room. There's the bay across the hall. They're just standing right there. And I was so excited. And I remember thinking, oh my God, this is going to be so exciting. I've read about this. I can't wait to see how this works. Well, it wasn't as awesome as I thought it would be. It was a little bit more terrifying, actually. So they gave the Narcan, stepped out, and it works quickly. Within seconds, this patient sits right up out of bed. She's cursing, she's cussing, she wants to get out of bed, she's fighting to get away. Like, she doesn't know where the hell she is, first of all. And I did the only thing that I knew of in that moment, and I jumped on top of her. And I was like holding her down. And I'm looking at my peers and I'm like, are you coming back? Because I am like freaking out in this moment. And I remember thinking, they did not tell me that in this book. They didn't say that the patient would be angry and hostile and try to get out of their bed and that I'd have to like jump on top of them. I was not prepared for this. And so they must have obviously came back in because we had to keep her safe. But that moment of using Narcan for the first time was quite traumatic. So I share that with you because if you're in the community and you give Narcan, first of all, as I mentioned before, it used to be only 1 dose, and if we got a response, that validated that it was an opioid overdose, and we could rule out every other cause. So we could rule out stroke, we could rule out seizure, we could rule out hypovolemia, low blood pressure, and all sorts of other things. And if it didn't work, we would start looking at other reasons as to why this person's unresponsive. Is it a tumor? Is it electrolytes? Is it sugars? But fast forward to today's world, 1 dose is no longer diagnostic. And in fact, we're giving 2 and 3 and 4 doses before we even get our first response because the drugs are so much stronger now that it's taking an awful lot more Narcan to actually have that impact. So I shared that story with you because if your patient does respond, I don't want you to be freaked out because remember, they took that medication for a reason, likely to get rid of their pain. And now we've just taken that all away from them, stripped it away, and they're waking up often in a place that they're not familiar with. They're not sure how they got there, but more importantly, all their pain is back, and they are not happy. Now that being said, I have worked with some street outreach nurses who have had very different experiences, and that sometimes the patients will wake up and say thank you, and they are appreciative because they know the risks, they have their Narcan kit with them, and they also know that if utilized, this is what's going to happen. And so this particular nurse has had some amazing stories. I wish that for you, but be prepared for the crazy. So let's take a look at what's inside this kit. Now when we first open up our kit, you're going to notice that there's 2 compartments. On one side, we've got a pair of gloves. There's also an airway device so that should your patient be in need of resuscitation, you have your own airway here to provide rescue breathing safely. There's also your prevention kit, and it will give you instructions here on how to use everything that's in here, and it gives a little bit more information about things such as the recovery position. and some alcohol swabs. On the other side, we have 3 vials. You're always given 3 doses of Narcan or naloxone. Each vial is a complete dose, and there is 0.4 milligrams per 1 mil. And in this one, we're going to give it either, well, we have the option of giving it through intravenous, intramuscular, or subcutaneous. So in the community, we're going to give it by intramuscular injection. And then you want to check the expiry date, and this one is expired. This is actually my test kit that I teach people with. Okay, so there are 3 of these. And the other thing you're going to have are your needles, of which there are 3. Now some kits will have the nasal spray. Others may have already pre-filled auto-injectors, but if you have this kit, I want to just talk to you about how to go ahead and draw up your medication. You're going to take an alcohol swab. You want to clean the tip of this off first. I like to leave my alcohol swab on there until I'm ready. And take out your needle. I'll just move this out of the way so we're just focusing on the needle. Okay, then you want to take off the cap, and that exposes the needle. We're going to just draw up a little bit of air. And we will insert it into the rubber stopper here. Turning it upside down to allow the fluid to come down to the bottom, and make sure your tip comes near the edge. You can see your tip inside of there. Let's see if we can get that for you. No, too hard to see. Then you'll withdraw all the fluid that's in here. All right. So what's going to happen is you're going to see that there's a mix of medication and air, and we need to get rid of the air. So we want to just push it. You can see the air moving up. And then you're going to see a little bleb here. I know my medication is ready. So we'll pretend this is my patient's leg. You simply just inject it straight in and push that plunger. Okay, so just to recap that, when you draw up, you need to draw up the full 1 mil of Narcan, which is 0.4 milligrams, that's 1 dose. You're going to administer it at a 90-degree angle into a large muscle, so into the shoulder or into the thigh. Now, how many doses are you going to give? Well, if you get a response with the first one, we know it's going to last anywhere between 15-20 minutes initially to about an hour. And that's really dependent on how much drug is on board for the patient and how naive they are. And what we mean by that is this the first time they've taken it? Because they may have responded really strongly, or they may not have responded hardly at all. So that will also impact how quickly they recover and stay awake. Now, after that time frame, if they start to fall back asleep on you, because they likely will, it will take more than 1 dose. That's when you're going to administer dose number 2. Boom, boom. Again, they're going to bolt up. They're not going to be happy with you. They'll stay awake for a while, and if they start to drift off again and become unresponsive, you give dose number 3. You're given a total of 3 doses in the community, and hopefully by then, your EMS has arrived. Now, if you've given the first dose and there's no response, you can go ahead and give the second dose at a 2 to 3 minute interval, and then you can give the third dose at a 2 to 3 minute interval, again, if there's no response. You will not harm anybody if you give multiple doses, because all it's doing is looking for that one receptor site, and it's going to sit in there. That's all it's going to do. And that receptor site just restores the cell to normal function. So if the cell wasn't unhealthy, nothing will change. Okay? Now in your kit, you have a total of 3 doses at 0.4 milligrams, so there's a total of 1.2 milligrams that you can administer. The nurse's drug guide says that if you've given 10 milligrams to a patient and they still have not responded to Narcan, then to start looking at, is this really an opioid overdose? There may be something else going on. So where should you get these kits, and why should you have one? These kits are available at pharmacies free of charge. You just go in, no questions asked, and you should have one if you have any prescription narcotics in your house, because you never know what people are going to get into. The other group of people who should have this are those who are using drugs recreationally, and you don't always know what's in the medication. You don't know how balanced the mixture is. You don't know if it's laced with something else. And so this would be handy to have on you at all times if you're going to participate in recreational drugs, and let people know you have it. That way they can get it if you need support. Now, there is a caveat in terms of the medication in here does have to stay at room temperature, so you don't want to leave this in your car in the hot summer or in the freezing winter. Make sure you bring it in with you everywhere you go. So that's it for our Narcan lesson. Go over to your pharmacy and grab one. You can even have it just for an emergency that you carry with you in case you ever need to respond. Stay safe, everybody, and until next time, make it a great day.
Sorry it's so quiet. It's me, JJ. I think I'm gonna take naloxone, aka Narcan. I think I'm ready. I know I said on a previous stream I was gonna wait till February. I don't see a reason to do that. I had a terrible night's sleep. I kept waking up doing this thing, and my thigh muscles, my front thigh muscles are so sore. Like I wish they're really sore. Feels like I ran a marathon. And what else? Had nightmares. I had Game Girl saying, "Gee, I'm sorry you're so dope sick, Zot." And I'm like, "Hey, how come you haven't aged, Game Girl? Look at how old I am." But then I think I realized it was like a nightmare or a dream at that point. And I think that was when I was reaching for this shit, this Narcan, this last night or nightmare, and I think I took like I still got pills. I do. These are just leftovers, nothing more than leftovers. You know, I'm dropping them all over the ground. I don't really care. I'll pick them up later. Hey man, like, I picked up my soda cans. That's pretty cool. I'm not a slob. I'm not a piece of garbage. I'm not. I'm just going through a rough patch. I'm going through a rough patch. And yeah, I'm really sick of this. I think if I take Narcan, it'll flush it out of my system. And when I say it, you know what I mean. And you just sort of go like that, and you just... These two are supposed to be expired, but I'll bet they still work. I'll use this one first, this one that's not expired. I'm really sure I'm going to do this. I'd like to see a video of somebody going through, the effects before I go and do this, because, like, you know what I mean? I don't know. Probably don't. I don't even know what I mean. It ain't like I'm experienced. Yeah. Haven't tried this before. But first of all, I'm not in the middle of an overdose, so that's a good thing. Second thing is, if you saw the video, she's like, the bully. This becomes the bully, the playground bully, and pushes all the fucking dope out of your receptors, your kappa, alpha, opioid, freaking, whatever they're called, I forget. Pushes them out, and then they're gone, and they're out. and you can rush your way through the process of being clean and non-dependent on this stupid shit. I think it'll work, but I just want to see. Let's see. What's for talks? All right. Let's see if this helps.
Once you come in here and you have to detox, you're traumatized. You're just constantly shaking because your body's hurting. For the mommies and daddies out there still running amok, still using tough. Some people get a fever, some people are throwing up. But being on Suboxone makes it 100 times easier. Hey, hey,
Jails do sometimes provide some basic care for people in withdrawal, but that can often be Gatorade and an ibuprofen. And they're not really fundamentally providing the treatment that somebody with an opioid use disorder needs.
In Bellingham, Washington, a recent class action lawsuit by the ACLU may impact how inmates across the country are treated for addiction.
Whatcom County has changed dramatically over the last 15 years. It's still a great community to live in. It's a great community to raise your family. But like the rest of the country, we're experiencing a heroin epidemic that has entrenched itself here in our community and is affecting crime. It's destroying lives and it's destroying families. It's something we're very focused on eradicating here in our community.
I've been working for the Sheriff's Office in the Corrections Bureau in the jail since 1981, so that's going on 39 years. Approximately 70 to 80% of our offender population has some issues with some type of substance. When we're dealing with folks when they're coming into custody, withdrawal is like a really bad case of the flu or a bad case of food poisoning.
It's like the flu, but 100 times worse. I've been an addict for 24 years. I was 13 when I first picked up.
Hello, ladies.
I've had my issues in the past when I was using and did some stupid things. Other than that, my charges are for driving. I started Suboxone about 8 years ago.
Suboxone is a form of medication-assisted treatment. It's prescribed by a growing number of physicians to help those suffering from opioid use disorder curb their craving.
There had been a couple of times I slipped, I fell off. When I came in last year, I was on Suboxone, and they didn't give it to me then, and so I had to detox. And so it set me up for a really hard time not being able to be given my Suboxone in here. When I got out of here, I relapsed. I relapsed for 10 months. I think that if I went back to last year and they gave me Suboxone, I wouldn't be here right now doing 180 days.
Our challenge in working with the criminal justice system is the transition from incarceration back out into the community.
Charles Watrous runs a medication-assisted treatment program in Whatcom County that often works with inmates in the first few days they're released from jail.
When we started our program in 2017 in Whatcom County, we wanted to coordinate and be able to continue delivery of services to our patients.
What's your current dose?
3 8-milligram tablets.
And it's oftentimes not until they get released from jail a week or two later that they said that they were not allowed to continue their medication, went through the horrible withdrawal process, and then were released and then trying to scramble to get back into treatment.
I know Whatcom County, yes, I've been there, so I know exactly. They don't care what you go through in there. When I went in like the second and third time, for stupid little things, I actually said I wasn't sick because I know they don't take care of you. They put you on the first floor and they call that sick thing, and they don't check on you.
We've always treated withdrawal symptomatically. We can give them pain medication, it's normally Tylenol. We'll also use medication that'll help stop the diarrhea.
We tried to offer Whatcom County Jail our support in getting their program off the ground, but it was sort of falling on deaf ears. It wasn't until Mark Cook from the ACLU reached out to me and said, we're looking at cases where patients are being denied access to medication-assisted treatment. And it really started the ball rolling from there.
We started looking at this problem of denying people in jails access to medications probably 2 or 3 years ago. And it was in that initial investigation that we started looking at Whatcom County specifically.
The county jail had been taking some steps forward. In 2016, Wendy and her medical staff began offering medication-assisted treatment to pregnant inmates.
If a pregnant woman starts going through withdrawal, she can lose the baby and she may lose her own life.
When I first started using heroin was 12 years ago. We thought since we could control all other drugs, we could control that one. We ended up being wrong. One time I was actually pregnant with twins and I came in and I lost, I don't know if it was from the gel that I actually lost the twins, but I did lose them at 6 months because one heart stopped and then it stopped the other heart. So it was from not taking Suboxone though. This time I'm pregnant too and they've been on it. So like I got in, I told them I was sick, I was on certain medications and I had them within 24 hours. So it's been a lot better.
We were working our way towards the medication-assisted withdrawal. It's just things are expensive and you've got to plan them in budgets and yada. And at that point, and still I would argue it's not necessarily the community standard within jails.
The lawsuit, Court Lever v. Whatcom County, was filed in June of 2018. The basic nature of the ADA, the Americans with Disabilities Act, is to sort of prevent people from being discriminated against because of their disability. And having a substance use disorder is akin to having, diabetes or heart disease. And what you've seen is that a lot of these facilities don't treat it as the medical issue that it really is.
Have you had any overdoses?
Oh yeah, I've overdosed twice.
Opioid use disorder is probably one of the hardest substance use disorders to treat without medication, but the easiest to treat with medication. Without medication, and this isn't including those incarcerated, there's only about a 10% success rate.
I wish I could just stay clean and not have to use Suboxone, if that makes any sense. But some people can't. One thing I would like, for the judges to understand when people come in and take care of their warrants, and this is why they ran for a couple of years, because back in 2018 or 17, they were forced to detox in jail. That's my issue.
The basic crux of this case is that people on MAT should be able to stay on that prescription medication too.
In April of 2019, Whatcom County settled the class action lawsuit with the ACLU and agreed to begin offering medication-assisted treatment to inmates suffering from opioid use disorder within 90 days.
Money that might have been spent in a lawsuit is now being spent on this program. I think it's a more humane way of dealing with people who have a very, very serious problem. And I'm lucky my sheriff does too.
We've agreed to the court retaining jurisdiction of that issue for another year so that they're certain that we're moving forward and fulfilling the commitments that we made, and that's just what we intend to do.
I think people have heard about the lawsuit and the results of it and said, well, I guess we better get on the bandwagon.
As of July 2019, the ACLU has successfully challenged jails in Massachusetts and Maine to begin their own MAT programs.
The states that have incorporated medication-assisted treatment into their prison system have had wonderful numbers coming out. They show a significant decrease in recidivism once they're released, a significant decrease in mortality once they're released, and a significant increase in treatment engagement once they're released. So there's a lot of evidence that points towards medication-assisted treatment.
So how about if we just do our check-in? Where would you be without medication-assisted treatment? And what have you been able to accomplish?
I'd be homeless for sure. I'd probably be dead. What have I been able to accomplish? Courage. To be me again.
The biggest thing I'd like...
This ain't what I need. I'm not trying to take Suboxone. That's just like glorified methadone. It's like a long, drawn-out, painful process I'm not looking for. I'd rather go through a short amount of severe pain rather than a long amount of subtle pain, or whatever. You know what I mean, right? Let's get this over with. Fuck's sake. I wish I could just see somebody going through the process. Is that too graphic or what? Like, what the fuck is this?
Before you renew Amazon Prime, watch this. Look, I love Amazon Prime. Free 2-day shipping is great.
What's underneath anger? It's all fear. And when you're scared, you just want to like make it go away. And the only way most people know how to do that is with drugs.
Tell me exactly what happened.
Another kid dead on the side of the railroad tracks.
They think they're gonna shoot a whole bag of dope down here, dude. If you sniff a little bit, you'll die. When the city has to start cleaning up dead bodies in the park, is when people finally notice.
I found a kid overdosed.
Can't sit here and promise you I'm gonna stay sober, but I can promise you eventually something's gonna happen.
Someone says, you can go to Florida and get clean. What could possibly go wrong? I found a kid overdosed. I don't know, he's on the side of the railroad tracks.
All these kids think they're coming down here as a person trying to get their life together. To some of the places they're going to, they're not a person at all. They're a policy number.
Help us help these kids and not die today.
When people don't get clean, when they attempt to, I don't hold anything against them, man. At the end of the day, they're trying. They might not be all the way done. But at least when I'm able to help somebody and get their foot in the door, it's planting a seed in their head. I don't get upset with people when they fail, you know what I mean? They go back out. I don't get angry at that person. The reason why is I'm basically that person. You know, I've been trying to get sober for damn near 15, 20 years. In and out of AA, in and out of this, in and out of treatment. You know what I mean? So it's like, I understand the obsession. I understand that it's a disease. I understand the process, the powerlessness, the hopelessness. I get that. Some people just haven't hit their bottom. I met this kid, Chris, a couple weeks ago. Chris, what are you doing out here?
Homeless, man. Roughing it up. Used my last $120 to fly myself down here. Problem was, is this time I didn't have health insurance. I have a baby at home.
How old's your baby, bro?
9 months.
9 months. The hell you been hiding at, bro? I've been looking for you for days. So you don't want to go to treatment no more?
I actually detoxed myself. I'm 9 days sober now. But like, I still need to get into like a halfway house bad.
Can you pee clean?
Yeah.
For sure?
Yeah.
There is a bed, but like I need to know like 100% that you can pass a test to get in there.
Yeah, dude. I wouldn't waste anyone's time, including my own.
Because I want to take you there like tomorrow.
Okay.
But yeah, I was gonna piss test you tonight just to make sure. I'm going to where Chris stays at. Last time we talked, he was really upset because I pee tested him. So I really want to help this kid. And with like the baby and everything involved, man, he just really reminds me of me, man. Just gonna go try to talk and see how he's doing today.
What's up?
How you doing?
You gonna kill me?
Huh?
You gonna kill me?
Nah, bro, I'm gonna be honest with you.
Yeah.
I'm worried about you, man. I'm a straight up, flat out junkie, dude. How am I gonna be mad at an addict for getting high? It's their natural thing to do.
Listen, man, it's not you being mad at me that worries me. It's the disappointment.
The problem's not the drugs. We're the problem, bro. If we don't realize that, if I don't realize I'm the problem, there's not a solution for it.
Exactly.
It's up here, bro. It's how we think.
I told Kelsey the same thing today. Like, I didn't give a shit about myself enough to even want to be clean. And then I met her.
I expect someone bigger, someone manlier.
What's up?
I want to call cops. I won't. What the
Chris, come on, man. Look at Chris. The second one.
Oh, no.
Back.
You didn't do anything?
When I walked up. This one,
I'm gonna call cops. I won't. Buddy. Buddy. Come on, bud.
911, what is the address of your emergency?
I'm behind the Publix in Blaine Beach. Come on, buddy. Buddy! Come on!
Okay, what is your name?
Allie Severino.
Okay, tell me exactly what happened.
I don't know, I found a kid overdose. I had some narcan in my car, so I tried giving it to him, but it didn't work. I don't know, he's on the side of the railroad tracks.
Take a second for it to kick in. I got another bottle right here. Go.
Allie?
Yeah.
Here, give him this.
Okay.
Here, give him the one narcan.
Stay with me and answer
Here, got
my
it. Do
questions,
it.
Okay.
I do have the police.
What did you just do, man? 3 hits of it so far.
We gave him 3 hits of narcan. I don't know the kid. I don't know who he is. I don't know how old he is.
How old approximately does he look? 20s, 30s, 40s?
He looks like he's in his 20s, mid-20s.
I'm saying my name when the police is here.
Okay, is he awake?
No. He breathed a little bit. We gave him...
Breathing.
I can't hear him breathing, no.
Maybe you haven't known.
I'm trying. No, he's turning blue, sir.
I need you to get him onto the ground and lay him flat on his back.
Okay, he is. I have him like that right now.
Okay, I want you to put one hand on his forehead, your other hand under his neck, and tilt his head back.
Okay.
This will help open the airway.
Okay.
Okay, I do have them on their way. They are going to be there shortly. I want you to stay on the phone, okay? And I'm going to tell you exactly what to do next.
Okay.
He's laying flat on his back on the ground.
Yes, sir.
Remove any pillows.
There's only grass, sir.
Okay. I'm going to tell you how to give mouth to mouth. Okay?
Okay.
Place your hand on his forehead, your other hand under his neck, then tilt his head back.
He's doing a death rattle.
Listen to me. Pinch his nose closed and completely cover his mouth with your mouth and blow 2 regular breaths into the lungs about 1 second each. The chest should rise with each breath. Did you feel the air going in and out?
Yeah.
Pinch his nose closed and tilt his head. Tell him to stay
Okay. Okay.
So when people come and they have been chronically on opiates for a long time for pain management, and it's no longer being effective due to hyperalgesia, tolerance, withdrawal symptoms, it's very useful to change them almost immediately from their short-acting opiate that they're taking for the pain management to buprenorphine. The reason is when you give buprenorphine and somebody's in mild to moderate withdrawal, you relieve the withdrawal symptoms with the buprenorphine, which is a partial agonist. But at the same time, when you stop the buprenorphine, the withdrawal syndrome from it is only about half the severity of what you'd have from a short-acting opiate. So that means you've immediately converted the patient from a high level of dependence with a very significant unpleasant syndrome. Not that opiate withdrawal is going to kill you, but it's in fact very unpleasant, bad case of the flu. And you've got a good start. And you can get that done within a day. What then happens next is, now that they're on buprenorphine, you can stop it after as little as a day or two. And you then want to start the actual medical withdrawal procedure. And the way you do that is you stop the buprenorphine. You can expect within 24 hours that they'll start having withdrawal symptoms again. But before they start having them, you would be giving them lofexidine. Now, lofexidine is, again, an alpha-2 adrenergic agonist. It relieves opiate withdrawal symptoms. You need to give it 4 times a day, but the dosage you give is fixed. So it's a set dosage that you give that dosage for over the 5 to 7 days of the withdrawal syndrome, although we're now going to talk about how you can make that withdrawal syndrome shorter. And the way you make the withdrawal syndrome shorter is, now that you've given them a day of lofexidine and they've now come off the buprenorphine, you could start giving them a very low dose of naltrexone. Now, naltrexone is ordinarily given at 50 milligrams a day as a way to block other opiates and keep you opiate-free. However, what you're going to do is give it at a low dose. Typical low dose would be 5 milligrams. Now, 5 milligrams is 10% of a 50 milligram pill, and there's various ways to get to that dose. Compounding pharmacy might be one way. Trying to cut the pill up into a tenth of a pill is generally fairly difficult. So what I typically suggest is it dissolves in water very easily, that you simply dissolve it in a fixed amount of water, and then if you want to give 5 milligram dose and you just dissolve 50 milligrams in 10 mLs of water, I think you can figure out on your own how much mLs of water you would then give them that has the naltrexone in it to get the 5 milligrams. You're then going to be continuing that lofexidine for the next 2 or 3 days, and as long as 5 to 7 days if you want. But the next day after the 5 milligrams, you're going to give a bigger dose of naltrexone. And that bigger dose could typically be 10 to 15 milligrams. Usually it would be 10. Now the third day, you would give them 15 to 25 milligrams of naltrexone. 25 milligrams of naltrexone is equivalent to 50 milligrams of naltrexone in terms of complete blockade of opiate receptors. So at that point, they are effectively opiate-free. And what the naltrexone has done for you, that's greatly reduced the duration of withdrawal, is it acts to bring normal opiate receptors to the surface of the cell, which is something that otherwise will take several days to occur, to sometimes a week and a half. But naltrexone will have that process, that receptor.
Continuous naloxone administration suppresses opiate withdrawal symptoms in human opiate addicts during detoxification treatment. N. Leumer 1, R. W. Schmid, O. Presslich, K. Lentz. Affiliations. PMID, 254-7057 doi, 10.1016/00223956, 89, 90020-4. Abstract. In a small clinical trial, a new therapeutic approach was studied, whether naloxone, in high dosage over a prolonged period of time, will attenuate withdrawal symptoms in acute opiate detoxification. 6 opiate addicts, satisfying DSM-IIIR criteria of opiate dependence, were given 10 mg naloxone under short barbiturate anesthesia, followed by repeated doses of 0.4 mg/h naloxone for at least 72h. Acute onset of withdrawal symptoms brought about a high dose of naloxone could be suppressed by the short barbiturate anesthetic. Neither continuous supply nor cessation of the naloxone regimen after 96h caused any severe withdrawal symptoms. Morphine and naloxone measurements in blood at the start of naloxone therapy enabled pharmacokinetic explanations for this paradoxical action of naloxone to be excluded.
'96, huh? So 3 days of feeling sick? Is that serious? Are they serious? Come on, man. 3 fucking days? Come on. I've got like 12 milligrams. They said 10. Granted, 8 of those are expired, but I'll bet they were. I got the stupid injectable bottle. I really don't want to fuck with a needle. I suppose that would be the one to start with, because when I'm freaking shaking and barfing and, oh man, it's so difficult. Just tell me straight up what's gonna happen, somebody. I just need to know what's gonna happen. Gotta prepare for it. I've only detoxed twice in the past 15 years, and I was in a hospital. Is that the first of this? I was in there for a week, and they kept giving me iron from all the blood that I vomited from my Mallory Weiss tear. Oh God, I'm trying to avoid that too. I have promethazine. I think that'll maybe help prevent barfing. I'm so ready to do this, but it's not exactly. It doesn't exactly seem like a good idea just yet, even though it's about the only idea I got.
Designed to rapidly reverse the symptoms of an opioid overdose, naloxone is a temporary treatment without long-lasting effects. Commonly referred to as the brand name Narcan, this medication is typically administered when someone is showing signs of overdosing on opioids, but this medication is also used during medical detox to help wean someone off their addiction. What is naloxone? Approved by the Food and Drug Administration, naloxone is an effective opioid antagonist that binds to receptors in the brain. Once it binds to receptors, it blocks the effects of opioid drugs such as heroin and prescription painkillers. Naloxone is not effective for treating overdoses of benzodiazepines or stimulants like cocaine and amphetamines. This medication is often used in emergency situations to reverse an opioid overdose and help restore normal breathing. In the case of opioid overdoses, most happen when an opioid causes the breathing rate to slow down to a potentially fatal level. Most pharmacies carry naloxone, and in some states it can be purchased without a prescription. Naloxone can also be obtained from community-based distribution partners, local health groups and health departments, usually for free. Drug and Alcohol Overdose Preparation Kit. Naloxone Injection Overdose Kit. How does naloxone in detox work? Some people who've become dependent on opioids fall into addiction require medical support to stop taking the drug. Naloxone works in drug detox treatment by temporarily blocking opioids from binding to receptors in the brain. The medication can be administered by spraying a mist into the nose. Sometimes the drug is given to patients via a shot into a muscle, under the skin, or through intravenous injection. What are the different forms of naloxone? Naloxone is available as an emergency nasal spray or injection. The three versions of naloxone that are available include an injectable version in vials that's sold as a generic drug, a refillable auto-injection device that you inject into the outer thigh, and a nasal spray that requires no assembly and is simply sprayed into one nostril of the individual while they lay on their back. Is naloxone safe to use in opioid detox? Naloxone is a safe medication to treat opioid overdose or addiction. It is even approved for pregnant women, under the supervision of a doctor. There is no evidence indicating that the extended use of naloxone causes harmful physical effects or dependence. People do not develop a tolerance to the effects of naloxone, and there have been no reported deaths from naloxone overdose. Naloxone exhibits essentially no pharmacologic activity in the absence of opioids, and the medication cannot be used to get high. How fast does naloxone work? Naloxone quickly crosses the blood-brain barrier and binds to opioid receptors in the brain, allowing it to reverse the symptoms of an opioid overdose almost immediately. Typically, normal breathing will resume within 30 seconds of naloxone administration. Naloxone in detox being used to rescue an overdosing patient. 4 mg narcan spray plunger being administered in the nostril of an overdose victim. How effective is naloxone in detoxing from opioids? If naloxone is administered to someone who is suffering from an overdose in a timely manner, the medication can be very effective in helping the person become conscious and regain normal respiration. Studies have shown that naloxone can shorten the length of detoxification, but may increase withdrawal symptoms. However, these symptoms are rarely serious health risks. What are the effects of naloxone? The side effects of naloxone are mild. The most common side effects include headache and joint and muscle pain. However, naloxone can bring on severe withdrawal symptoms if administered to someone who is opioid dependent. Symptoms of induced opioid withdrawal may include nausea and vomiting, diarrhea, sweating, trembling, nervousness, fast pulse, anxiety, agitation,
Alright, this
abdominal pain,
is pointless.
muscle aches, chills and goosebumps.
Let's play some video games. I don't need to think about this, I just did it. Hopefully I'm gonna be done with opioids soon. That was really no big deal. I'm wondering what I'm gonna feel in a minute. Or two, or an hour. Supposedly it's gonna rip away. You saw the fucking video with the nurse? It's gonna push my fucking opioid receptors out of their little crevices. And this thing is supposed to fill that area. So, no big deal. 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 It's no big deal. 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 NBD. 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 Gonna be no big deal. Clean. I won't be that twitchy. Fucking fuck. Sick of this. It's like every day gets worse. Alright. My controller became desynced. Fix that. Did you notice? I fucking sniffed it as soon as they said it's safe. I'm like, all right, fuck it, it's safe. Let's do it. Oh man. It's safe. There we go. Oh, ouch. Ooh. Here we go. There we go. Whoa. Not bad. Whoa. Hey, you like my penguin head? Penguin. Oh.
Do another one. This 20. Yeah. Since 2021, it should still be good, right? Drugs don't really go bad that quick. All right. Wish good luck again. Double dose. That time fucking flexed me out. What will? feel very, very hot. Way hotter than I do. I don't know if video games are gonna help right now. No. What does metoclopramide do? Feel an upheaval in my guts. It's not pleasant. This promethazine is supposed to help with that. I can't finish this. Oh, god damn it. What did I get myself into? I don't even care. I just hope it fucking works. Seriously.
It should. Too much. Good to go. Oh, by the way, I can say that the Narcan is slightly bitter as it drips down the back of my throat. It is bitter. I feel cramps in my stomach. Not diarrhea cramps. No, I don't know what they are. That promescent symptom helps. I can feel it stronger. Nauseous. Not good. I'm sorry, I can't party. I can't. I need to log out of Xbox. I think I am. God. Oh, I can't party. It's cool, man. I think they'll understand. So, and appear offline. There, I'm offline. This isn't good. I'm still burning up. This is pointless. I got some weed around here. Some hemp. I'm gonna smoke some hemp. Yeah. Fuck this. You like that? That's my car lighter. Now I'm getting chills. That's stereotypical. Oh, it does work. Neat. There may be hope for me again. Oh, excuse me. think my lungs are working better already. It's nice. Sorry, I'm so boring. I was gonna play video games. How do I keep yawning? I was tired. Another yawn. Oh, I'm getting the runny nose. Oh boy. Hello, watery eyes. Yeah. Yay. It's all gonna be over. It's a really shitty way to live, you guys. It's looking forward to it being over. Should probably do the third one. It's over with. What did I do with it? There we go. Do the third one. Come on. Done. Oh, yeah, there's the bitterness down the throat again. Ooh. Felt that one in my balls. Clean already. I don't think they moved it. 72 hours? That's crazy. I don't need it. Fuck no. I'll be over with it a little bit. But in an hour. Woo! Did I get all of it? Yeah, I guess so. Ooh. At least I don't have an active backache going on. I know. I gotta pee. I don't want to do this anymore, you guys. I'm gonna go.